Just 5 years after the world was shaken by the COVID-19 pandemic, we now face a new threat, and it's raising serious concerns. Reports have been flooding in, and this time it's coming from China. The country is currently grappling with an outbreak of human metapneumovirus, or HMPV. While social media buzzes with alarming headlines of overwhelmed hospitals and rising fatalities, there's a lot of uncertainty about just how serious the situation is. So, what exactly is HMPV and how does it stack up to previous outbreaks like COVID-19? Is it as dangerous as it's being made out to be? Today we're diving into the facts to separate fear from reality. As we reflect on the devastating impacts of COVID-19, it's easy to feel a sense of déjà vu. China, once the epicenter of a viral storm, is again seeing a rise in infections, but this time it's a virus many might not recognize. HMPV. HMPV, or human metapneumovirus, might not ring a bell for many, but it's a known respiratory virus that's been circulating globally for decades. Initially discovered in 2001 by Dutch researchers in children with respiratory infections, it's an RNA virus from the Metapneumonas genus. HMPV has been around for at least 60 years and is considered a major global respiratory pathogen. So why is it suddenly getting so much attention? Let's break down how it spreads, its symptoms, and what makes it concerning today. Think of it like a bad cold. Symptoms of HMPV include fever, cough, and fatigue. But don't be fooled. For some, it can develop into more serious respiratory issues, especially in people with weakened immune systems. So, how does it get transmitted? Well, like most respiratory viruses, it spreads through droplets when someone coughs or sneezes. Close contact with an infected person or touching contaminated surfaces can also put you at risk. HMPV is typically contagious for 3 to 5 days, and though it circulates year-round, it tends to flare up in colder months like winter and spring. Unfortunately, unlike some viruses, your immune system doesn't build up long-term protection from HMPV, meaning reinfection is possible. So what can you do to stay safe? The precautions are familiar. Wash your hands regularly, especially after being outside. Avoid touching your face with unwashed hands and maintain distance from infected individuals. And if you're feeling sick, stay home. Experts also recommend covering your mouth when sneezing and not sharing eating utensils. While the rise of HMPV is concerning, it's important to stay calm, informed, and proactive.